If you've ever wondered what it's like to have OCD and other things that can come along with it, like anxiety or depression, that's what we're going to talk about today. Hi, I'm Dr. Patrick McGrath, Chief Clinical Officer at NoCD. Welcome to the Get to Know OCD podcast. If you like all this information and you want to know more about OCD, please subscribe. Sometimes we'll have guests on to talk about what it's like to live with OCD, and other times we'll have information about new research that's out about obsessive compulsive disorder as well. So stay tuned as today we talk about what it's like to live with OCD and some of the comorbidities that come along with it. You might wonder, what is a comorbid condition? Well, it's something that comes along with obsessive compulsive disorder. Frankly, it's something that comes along with any condition that you might have. It's comorbid, meaning that you have two things or more. In our world, we're going to talk about obsessive compulsive disorder. So we'll talk about some of the common conditions that come along with OCD. Now, first of all, OCD is listed in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, in a category called OCD and related conditions. And those related conditions are hoarding. There are body-focused repetitive behaviors like trichotillomania or hair pulling, or excoriation, which is skin picking. And then you'll even have, of course, OCD itself. And there's also tics, which are either verbal or behavioral stereotypical types of movements or sounds that people will make. In fact, one of the things when we're doing a diagnosis of OCD at the end, in addition to asking about the insight that someone has into their OCD, how good they recognize it being OCD versus something else, we also want to know if there's been a history of tics that occur in people's lives as well too, because it appears genetically that there may be some links between OCD and tic disorders. So let's talk about those first. What are tic disorders? Well, they're disorders of movement or sound in some ways where people will make certain types of vocalizations or they will do certain bodily movements. They have what we call a premonitory phase, which is a buildup of tension in their body, and they attempt to relieve that tension by doing some kind of bodily action or vocalization. There's great treatments available for that, something called habit reversal therapy, and we can talk about that in a future episode. We'll maybe bring a guest in on that one who really specializes well into that. Other things that can come along with OCD, well, you might have heard of hoarding, and hoarding is, of course, a difficulty in discarding things, which that definition might surprise you because you might think of hoarding as lots of gathering of stuff. But if you've gathered up so much stuff that there's no more room in your home, but you're not getting rid of anything and you're no longer gathering everything, you still have hoarding. So hoarding really is a problem of discarding of things. And we can work with people on helping them to get rid of some of their stuff so that their home starts to be used as a house and not just as a place to store things anymore. There's trichotillomania, or we call it hair pulling as well. And that's people who pull out their hair. And that could be from all over their body, from their head down to their legs, their pubic area, underarms, anything of that nature. Many people don't even realize that they're doing this until they look down and they see a pile of hair in their lap or on their floor or something of that nature. Some people, though, take it to a certain extreme and search for certain hairs and then play with, maybe even if you pull it out and there's that little nub on the bottom, and they might play with that or smash it or anything like that. And some people even eat the hairs as well, too, which can lead to a very serious condition called a trichobazar, which has to be surgically removed from people's stomachs because we don't have the ability to expel hair out of ourselves the way that, say, a cat does with a hairball. Other people have excoriation or skin picking. They don't leave scabs alone. They're constantly trying to do their own microdermabrasion by picking at something until it's smooth enough, but never quite get to the right surface that they would like it to be. The smoothness isn't quite there. So they keep doing these things over and over again, and it just leads to more and more scarring on their body instead of anything else over time. Other comorbidities outside of the OCD and related conditions could be things like depression. It isn't uncommon for people with OCD to have major depressive disorder or even a persistent depressive disorder, which can be a kind of lower level depression, not meeting the criteria for a major depressive disorder, but this lower level depression that lasts for 2 years or longer. And it could still be very debilitating for people's lives. Why would people with OCD meet criteria for a depressive disorder? Well, if you think about it this way, OCD attacks the things that you love. And if you stop engaging in the things that you love, that's a problem. And if you look at the definition for major depressive disorder or persistent depression, the two things you're looking at is that you feel depressed or you have a loss of interest or pleasure in things that you once enjoyed. Well, if OCD is attacking the things that you enjoy and you're no longer getting pleasure out of them because OCD's attacked them, that could be a reason why you're starting to feel depressed. So it wouldn't be uncommon then to see both of those conditions together. In fact, it is rather common to see them together. OCD can also be uh, friends, shall we say, with the anxiety disorders, and you might have several different kinds of conditions that could go on there. I've seen people who do compulsions because they're afraid if they don't do a compulsion, they'll have a panic attack. This might not meet the criteria of panic disorder per se, but that panic attack is scary enough to keep people doing compulsions. So we want to treat those panic attacks. There's a great treatment out there called interoceptive exposures, where we expose people to symptoms of panic. We have them do things like, spin in a chair or breathe through a straw. We have them run in place, hyperventilate. We might even have them watch various visual illusions and kind of get their eyes to go cross or something of that nature. And we want them to learn that they can handle all of the symptoms of a panic attack. They don't need to be afraid of it. No one's ever died of a panic attack. Some people will meet criteria for panic disorder, actually, too, and that could come along with OCD. So they may have both happening at the same time. There could be panic attacks that just come out of the blue and happen. And OCD sometimes will like to be the thing that grabs onto that and says, hey, we can prevent panic disorder. We can prevent panic attacks. Do these compulsions. We see that in post-traumatic stress disorder as well, too, where people might have had a traumatic experience, and OCD, being kind of the opportunistic jerk of a disorder that it is, will say, ooh, you've had a bad thing happen. I know how to prevent bad things from happening. You do compulsions. And now OCD snakes its way in to try to get people to do compulsive behaviors. This is why it's not uncommon to see people with PTSD also have OCD or OCD-like symptoms as well. You might have a phobia, right? Now, a phobia is different from OCD because a phobia is usually focused on one thing versus OCD hops around from sub things over time. And OCD doesn't care if you're around the thing you're afraid of it not or not, it's still going to bother you about it. So if you have a phobia about, say, driving, you may just not drive. You may get people to drive you all the time, but you're never driving, and therefore you're never responsible for something that might happen in a car. And if you can figure out a way to live that way, as unfortunately lots of people do and don't get the treatment for it, it won't really bother you all that much as long as you're never having to face having to drive. OCD isn't like that, of course. OCD is always with you and always demanding that compulsions be done in order to neutralize any of the thoughts or the images or urges that may be going on. Some people may have social anxiety disorder, which is a fear of judgment or evaluation in social situations. I also like to think of it differently than the DSM describes it. I also like to think of it as many people with social anxiety already believe that they're misfits or something's bad about them, and they don't want to do anything that would allow people to confirm that belief. And so they stay away from social situations. They also abuse a lot of substances, and alcohol is unfortunately a common problem among people with social anxiety disorder, as they use it almost as liquid courage to get themselves into social situations. This can unfortunately lead to an addictive experience as well too. If people have OCD and social anxiety, some of that could be a relationship between the two in the sense that people are very embarrassed about their obsessive compulsive disorder. They don't want other people to know or see it. They wouldn't want anyone else to know what they're doing. They would find it so embarrassing to have to reveal what's actually going on in their head. So it wouldn't be uncommon to potentially see those two together. One that often gets misdiagnosed is generalized anxiety disorder, and people kind of lean toward that more because they hear about obsessions and they think, well, people are really worrying about these things. But many people who aren't trained in OCD just stop there. They don't go looking for the compulsions. And if you miss the compulsions, you'll probably just diagnose someone with generalized anxiety disorder and might not do the level of exposure and response prevention or medication treatment that is really necessary for someone. So it's always necessary, if you are treating people who have this and you're listening to this, make sure that you're not just focusing on what are the things popping in their heads, their what if statements. Find out if compulsions are happening as well too, as a way to neutralize them. If they're not happening, you might have more of a generalized anxiety disorder, which is typically more worries about day-to-day types of things versus OCD, which goes to extremes and lots of taboo types of topics as well too. And OCD has compulsions going along with it. I hope that this has been helpful for you to understand some of the varying ways that OCD and other conditions might present in your life. Sure, there's other things out there as well too that could happen. I mean, one of the big fears that I get and one of the themes we sometimes see with OCD is, what if I have schizophrenia? What if this is not actually OCD? What if this is psychosis? Or what if I were to develop psychosis? And people will constantly be checking or assessing to see, are they in touch with reality or something of that nature? I want to tell you now, and I will tell you once as an assurance and not again as a reassurance, OCD does not make people have schizophrenia. But so many people are afraid of, boy, if I have an odd or a strange thought, does that mean that I have psychosis or schizophrenia? There's other people who will go to doctors constantly because of OCD, looking for other diagnoses that might be medical conditions, right? You might see people wanting to have tests run on them consistently over and over again, or even doubting if the test result was right. In fact, I know of someone, and you can probably go online and look up this speech where he described going to get a test on his brain. And as he was coming out of the machine, he bumped his head and convinced them to put him back in the machine again, just to make sure that that bump didn't do any brain damage to him. And he's very open about this and a great OCD advocate. I hope that this has given you some information about OCD and other conditions that are out there. We know that there's great treatment for OCD, but there's also really good treatment for these other conditions as well too. Anxiety-based disorders can be treated with a form of exposure and response prevention therapy as well. Panic can be treated with interoceptive exposure therapy. Post-traumatic stress disorder can be treated with a prolonged exposure therapy. And major depressive disorder can be treated with something we call behavioral activation, where we get people up and out and moving again and doing things. There's so much good therapy available, but hopefully you or your loved ones are using it. I know that there's a stigma out there about having a mental health condition that unfortunately persists to this day. But know this, there's nothing worse about having a mental health condition than there is about a physical health condition, even if certain aspects of our society might say that there is. There's sadly some beliefs out there that people hold, which are, you should be in total control of your brain, even though it's okay to not be in total control of your body. It's fine if you get a physical health problem. That we'll accept. But we won't accept that you won't have total control of your brain. That just doesn't make any sense to me. And I hope it doesn't make sense to you. And I hope that you recognize that you are in no more control of the way your brain is functioning than you are of your pancreas or your liver or any other part of your body as well too. Sure, there are things that we can do to try to make our health the best that it can be, and we can do that both physically and we can do that mentally as well too. And that can also be a part of the work that you're doing with a therapist, to be sure that you're doing the things that are the best thing for you. When we're treating OCD, the best things to do are to get out there in the world, expose yourself to things, and not do compulsions. If you're depressed, the best things are not sit around hoping and thinking about things and hoping that that's going to make a change. It's getting up and going out there and doing things. Sometimes people are waiting for the miracle to happen, and I say, go make it happen. Don't sit around and wait for it. If this information has been helpful to you, which I hope it has been, well, subscribe to the Get to Know OCD podcast. We're going to keep doing this and have more information about OCD out there, as well as bring in some guests to talk about what it's like to live with obsessive compulsive disorder as well too. You can also check out our YouTube channel. In fact, I do a webinar every Wednesday night, and you can check out all the old episodes on the YouTube channel and join me on future Wednesdays and even throw in a question. I'd be happy to try to answer it if I could. Thanks again for watching. And if you're looking for treatment for OCD, check us out at nocd.com or treatmyocd.com, where we have care team members waiting to chat with you. We'll do a free 15-minute call with you to talk about what you can do to start managing obsessive compulsive disorder and live the life that you want to live and not the life that your OCD wants you to live.